Hello everyone, I'm Chris Darcy. I chose UHIV case management and behavioral support services for my internship. Through my practicum, I was able to assist clients with supportive services such as housing, food stamps, mental health needs, and even application to Ryan White program. I was also able to conduct intake and psychosocial assessments, service plans for clients, and following up with their HIV status. I was also part of interdisciplinary meeting. I was able to participate in different team meetings and programs that assist HIV clients. I was also fortunate to experience working in the field outreaching clients from different homeless shelters. During my internship, I always ask why individuals do not seek treatment. Well, HIV is not curable, however, it is manageable. Individuals who are diagnosed with HIV can live a longer, happier life. There are treatments and medication that can help HIV under control. Good mental health, a stable, safe, and clean environment are necessary in treating HIV successfully. However, due to social barriers and fear of being judged by society, some individuals would rather not seek treatment. So, what social barriers do people with HIV commonly experience or encounters? I decided to do my research that focus on homelessness and stigma with people living with HIV. So, as we all know, stigma is a huge social barrier to care for people living with HIV. In this research, I found a program called Health Stigma Framework. It provides an excellent heuristic model. Health Stigma Framework suggests three HIV-related stigma mechanisms that can affect health outcomes. So there is enacted stigma. It is a previously experienced discrimination, prejudice, and devaluation someone has experienced from others as a result of their HIV positive status. And then there is anticipated stigma. It is how someone expects someone will treat them or act towards them as a result of their HIV status. It is more of a base on beliefs than past experience. Then there is the internalized stigma. It is when someone accepts the negative label and perception for people living with HIV and then apply them towards themselves, such as deprecating emotions like shame, embarrassment, low self-esteem or self-worth, and even self-blame. However, there is also a proposed additional mechanism for health stigma framework called perceived stigma in the community. This is which is when a person's perception of how severe the stigma attitude exists in the community. It is believed that it has a negative effect on self-concept, which in turn affected, affects cognitive and mental health outcomes. So, risk factors associated with stigma, refusal of care or treatment, increased traumatization, physical and emotional stress, increase in financial burden to some patients. They prefer to travel further to be seen by a provider who shows them respect and dignity, while others have fears of discrimination and others have concerns like running into someone they know. So the second barriers to care is homelessness. Many of people living with HIV and families are faced with losing their homes once diagnosed with HIV. The inability to meet basic needs places a burden on individuals who are living with HIV in regard to accessing health care, health maintenance, and medication adherence. So, more than 20% of the US home populations are people living with HIV, with an estimated 1.6 million requested housing in 2016. Of those, 320,000 are people living with HIV. Viral loads are 3.84 times higher in homeless individuals compared to people living with HIV that are housed. There are also higher rate of chronic diseases due to lifestyles such as drugs, alcohol, or tobacco use, as well as environmental factors like exposure to extreme weather conditions, violence, and nutritional deficiencies. So, what factors that increases the risk of homelessness for people living with HIV? So, there's job loss, there's history of mental illness and periodic hospitalization, cost of healthcare, substance abuse and addiction, domestic violence, and lack of affordable housing. As social workers, it is a challenge that we will have to deal when helping people living with HIV. This might be a complex service needs, but we should educate ourselves about different resources in the community that we can link people living with HIV. There are organizations and agencies that provides funding sources for people living with HIV and their families. So let's discuss how can we reduce stigma and homelessness with people living with HIV. So reducing stigma and homelessness, there is better access to support services such as basic necessities, food, affordable housing, transportation, and access to healthcare. Also, education and training for healthcare workers. I believe that additional training, education, or workshop for sensitivity, compassion, and empathy, requiring participants like health facility staff or clients or both to actively engage in the intervention. There is community education, providing a community education discussing transmission, prevention, and treatment, as well as how to care for family with HIV. Policy change, advocating for policy changes or restructuring the support system that provides support for the homeless um, people with HIV. And there's a peer support. So peer supports are individuals who are treatment adherent and share similar experiences who lives in the same community. They are also trained to provide counseling, encourage and encouragement to continuously engage in treatment. They provide peer support for newly and diagnosed and existing patients. So in my conclusion, so are supported services effective in reducing social barriers? So in my research, support services are effective if the diagnosed individual is willing to accept the help being offered and support continues until individuals are deemed capable of taking care of themselves and their needs are being met. Um, how being compassionate affects people living with HIV. So being compassionate improves the chance of people living with HIV stay on treatment and adhere to medication, making them feel worthy once again. And third, should there be consequences for healthcare personnel stigmatizing people living with HIV? Though denying care for people living with HIV is illegal, it should be mandatory for staff providing care to HIV clients to have training and workshops. And that's the end of my presentation. It's nice working with you guys. I really enjoyed this semester. Good luck to your future endeavors. Thank you.